Burnout and Beyond, a podcast series from NHS Practitioner Health with me, Dr. Lee David, and my co-host, Dr. Richard Duggins. Today, we're exploring what it means to thrive at work and in our lives. Thriving is more than just coping. It's a sense of energy, growth, and moving forward rather than feeling stuck. Thriving enables us to feel more engaged, connected, and able to handle whatever comes our way. When we thrive, we feel better ourselves, and it can also lead to improved patient care and outcomes. Thriving exists on a continuum stretching from burnout through to surviving and then on into thriving. It's influenced not only by what we do ourselves, but also by the conditions around us, including having some control over how we work, access to support, and supportive relationships with colleagues. But positive strategies can't compensate for unsafe or unreasonable working conditions. And if you need effective mental health care or the environment itself needs to change, those are the essential first steps. Thriving isn't about pushing through, it's about having the right support and space to function well. I'm Dr. Lee David. I'm a GP, CBT therapist, and one of the lead clinicians here at Practitioner Health. Alongside my clinical work, I write wellbeing books and I host the Choice-Based podcast where I look at how everyday choices can influence our health and wellbeing. And I'm delighted to be joined by my co-host, Dr. Richard Duggins, and I'll let Richard introduce himself.
Hi, I'm Richard Duggins. I'm a psychiatrist and psychotherapist, and I also work at NHS Practitioner Health. And I also am an author, and I've recently written Burnout Free Working.
So let's start by thinking about how we define thriving, and then we're going to look at a really helpful model for thriving, the care model that Richard uses in his book. Corey Keyes describes thriving as flourishing. It's a state of positive mental health, and that's not just the absence of illness. It's where people feel well and function well, where we have a sense of purpose, good relationships, and the ability to manage life's demands. Gretchen Spreitzer and colleagues describe thriving at work as a combination of vitality, so feeling energised, and learning. They found that thriving is more likely when people have some choice in how they work, when we understand what's expected of us and we feel trusted and respected. And this helps us feel more in control, capable, and connected. So it really is very much about environmental factors as much as what we do ourselves. So Richard, what do you think of those definitions of thriving and how do you see it?
Well, I mean, they're both excellent definitions. I'm really pleased we're talking about thriving. So we're moving away from talking about avoiding burnout to actually how are we thriving in our lives at work and beyond work. I'd go back to what you said right early on, which I tend to think of thriving as part of that continuum. So with burnout at one end of that kind of spectrum, moving to surviving at work, which so many of us are doing, and then moving beyond that to thriving at work. So a kind of continuum. And I think that's a really useful way to look at it, partly because the things that move us from burnout to surviving at work are also, to some extent, the things that move us from surviving at work to thriving at work. The other thing I'd say about thriving is the kind of the outcomes we get from thriving. So I often think of a book that had a big effect on me, which is Oliver Burkeman's book, 4,000 Weeks. And one of the things he says in this book is our lives is only 4,000 weeks. So how do we use that? And I think that suggests that really we should be aiming to have as many of those weeks as possible where we're thriving. It's not possible to be thriving every day or every week or even every month, but can we aim to be thriving in our personal lives? But also thriving is good for our work. So if we are a health professionals thriving, we are likely to be more productive. We're likely to make less errors, so our patient safety will be better. And we're also likely to have better satisfaction from our patients or clients. So thriving is both important for us as individuals, but also for getting really the best out of our work.
Yeah, I agree. And I'm just really interested in that idea of the continuum where we think about burnout at one end, we're surviving, and then we move on to thriving. And I'm wondering whether, Richard, you think sometimes we get a bit stuck in surviving and we don't get any further. So we get to the point where we're not perhaps unwell, where we're coping day to day. And have we given up expecting more? And is it realistic to want more? I feel like we deserve more. Like, it's so important that we're able to feel fulfilled, that there are positive experiences about work. And I think there's good evidence that work in general terms is good for people's mental health and positive mental health as well for thriving, because it gives us a sense of purpose and connection. But I wonder if there is a risk that we sometimes just settle for the survival.
Yeah, I mean, absolutely. And we know from, from things like the NHS staff survey and other surveys of health professionals that a lot of people are burnt out at work and a lot of other people are just surviving at work, getting by. So not that many professionals are thriving at work currently. But I think you're right. I think we do deserve it. I think we should be able to expect it. We should be able to expect that we do that. And you're saying that work should be good for us. I'd go a bit, I'd kind of specify that a little bit because we know that good work is good for us. So we should expect our work to be good, and we should expect really that mostly it is good for our health. It reminds me a little bit about I was doing a wellbeing talk. It was an after dinner wellbeing talk for the Royal College General Practice a few years ago. And I was having the meal before the talk with a GP, and he was quite challenging to me. He said, "You're not going to give me one of those wellbeing talks where you're going to put a picture up of a flower growing through some broken concrete." I don't know whether you can picture that immediately. We see it quite a lot. And he said, he said, I really hope you're not going to do that. And I was saying, well, I was curious. I was like, what's that all about? And he was saying, actually, my life at the moment is really, really difficult as a GP. You know, lots and lots of demands, not much support, very hard to meet the demands with the resources we've got. And really he felt like he was in that kind of concrete environment, very difficult to thrive. And I think what he was telling me was something really important, which is if we think about that flower, that actually flowers find it really hard to grow if they're not in good soil, if they're not watered regularly. So, a flower needs a good garden, it needs a good gardener, or it needs a good meadow if it's a wildflower. And actually, if you're a flower and you're not being watered regularly, you're not in good soil, it's really hard to thrive. And I think we have to be realistic about that, which is that the advice that we're going to give today, and we're going to talk about the care model, will only really work if you're in the kind of environments that allow you to thrive. And if you're not in that kind of environment, then it can be very difficult, even if you put all of these things in place. And it may be that you'll have to make some bigger decisions if you really want to thrive in your work.
I really love that idea, and that image is really powerful. And what I'm thinking is we don't want to aspire to be a single poor dandelion fighting through the cracks of a dried concrete pavement. That doesn't feel like what I'm after in my working life. That image is definitely not how I would aspire to live. And so I think I agree with the GP who spoke to you. And I love your idea of the garden. I would aspire to my life representing that, where there's lots of beauty around and complexity and different flowers at different points in the year, and maybe a whole range of stuff. And it's not perfect. It's okay to have a few patches of grass that don't grow brilliantly, or a bit of work to do, but it really feels like we're aiming for something that is much more than just, because that feels like survival and then badging it as, oh, this is really good, and actually that's missing the point. And I think it's so important that if somebody perhaps is burnt out, if they do have a mental health problem, that actually that's the fundamental starting point. We need to look at workplaces, we need to create that garden, we need to get the groundwork in, we need that fertilizer that's going to enable everything to grow, and then the thriving comes on top. But I don't think we can forget the thriving, because otherwise it's like you've got your lovely garden, or you've got new allotments, but then you don't plant the seeds that allow you to then harvest. So it does feel like there is an element where thriving is also important on top. What do you think?
Yeah, I'd agree, and I think we all should be aiming for it. I think we should be expecting it, and I think our leadership should be aiming to have a thriving workforce, because that is what is best for them, and it's also what's best for our organisations and our patients.
Definitely. So we're thinking about how to do that. And as you said, many of the strategies that move us, that we've talked about on the previous podcasts around managing burnout, preventing burnout, and then progressing, if we've gone down towards burnout, how do we come back up? And so, but let's review those and think about how they might flex around that increased sense of thriving. I really like the care model, Richard. Could you share that with us and just talk us through it sort of briefly, and then we'll talk in more detail about the steps?
Yeah, so a lot of my book, I'm focusing on avoiding burnout in the burnout-free working. But this chapter, I really wanted to say, what do we need to do to move beyond that kind of survival to thriving? And I use the metaphor of an electric car. So I kind of think, you know, imagine we are an electric car. So what is going to give us a great, safe, rewarding, perhaps a bit exciting journey? And I say we need to do four things, which are the care model, and it's an acronym. So care is CARE, and the first one is the C, which is we need to charge our batteries. So we need to keep doing things and doing them regularly that genuinely replenish us. So that's our decompression activities, that's our socializing, that's all of those things that charge our battery. And we need to be doing that. We need to be doing it regularly, and actually we need to be doing it so we're a bit overcharged, so we haven't got a kind of range anxiety, which I think is the kind of surviving bit. And then the A is anticipate hazards. So life will throw curveballs, those big curveballs in life, but also those everyday ones. So anticipate those and get some good charge in your battery. But also, if you know they are coming up, plan for them, adjust your life, adjust your journey for them. The R of care is read your dashboard. So know what your early warning signs are of stress. Spot them, see them on your dashboard, and make adjustments for them. So you're kind of, it's the equivalent that if your low tire kind of warning comes up on your dashboard, you pump up your car tires to keep your performance high and to avoid having a blowout. Do the same if you get those stress things. Act on them early. And the E of care is early maintenance, which means that very much acting early and reaching out for support before they worsen. So we don't put up with kind of driving around in a kind of worn out banger. We keep ourselves kind of on top form and top performance. So that's the care model. It's a practical model, but it reminds us that thriving is not accidental. It needs attention, it needs care, it needs small adjustments, and it needs those really made on a daily basis. We need to kind of be very intentional about caring, caring and thriving, if that's what we want to do.
Yeah, so it's sometimes takes quite a bit of energy, doesn't it, to put those things in place. And we sometimes feel, oh, I don't have the energy to plan that positive thing, or oh, I'm just going to sit and scroll on my phone. And whilst that's not bad, it might be that is actually reading the warning signs, as you mentioned. But it's also so important to view it as something that's not optional. So, like you're talking about a car needs maintenance, a car needs regular charging if it's an electric car, and we can't just leave that and put it off and put it off and put it off and then be surprised when the battery's flat and it doesn't take us where we want to go. And I think we need to do the same, even if it takes a bit of time to go and connect up that charger, or it takes a bit of energy to have to book the service at the garage. We do need to make that effort if we want our lives and our cars to keep driving effectively. So let's think about them one by one. And I like the image of charging a battery. Now, I'm struck by that because I'm often told off for frequently charging my phone, and I'm told that's going to ruin the battery because it loses the range. But in this case, I'm just wondering if that's actually the best strategy, is lots of frequent short charges to keep it ticking over, rather than letting it run all the way down to the bottom and then doing one massive charge all the way back up again. And I wonder what you think, Richard.
I hadn't thought about it that way, but I think you're right, aren't you? That stress builds up on us on a daily basis. So what are we doing to kind of manage that stress on a daily basis? So absolutely. So that kind of regularly charging things through through our decompression activities, those kind of hobbies and fun activities, or kind of relaxing things that we do, but also, making regular contact with our friends and support network. So yes, I think that's right. Frequent small charges. That's the way to do it, isn't it? That daily charging.
Do you think any particular activities that in your experience have a particular, you've mentioned social activity there, that are particularly effective that give like a supercharge, that give us the most bang for our buck? Or is it very individual? What's been your experience in that in your clinical work?
Um, well, I think the important thing is to find out what works for you. So it is individual. And So find out what works for you. If you've lost those things, what used to work for you, because the things that used to work might be the things that you need to get back to. For some people, it will be very active things. It'll be exercise, and or going to the gym or doing the choir, something quite active like that. There are some perhaps additional benefits of exercise. Because you're benefiting from the exercise and also the distressing yourself, the removing of stress yourself as well. But some people get just as much kind of benefit from their stress by doing kind of quiet activities, what are sometimes called finding their restorative niche, which might be things like mindfulness, but it might be gardening or cooking or jam making or reading. So the key for me is just find out what works for you. And then once you've found out what works for you, make sure you do them regularly. What do you think,
Yeah.
Lee?
Yeah, I completely agree. And I think it is very variable. And it's also noticing what we need at different points. So getting out, if we're getting a bit tense, we're thinking a lot, we're overthinking perhaps, then movement can be a great way to just decompress the mind and just reduce that sense of pressure, turn down the threat system, and process some of those difficult emotions of the day really effectively. But if we're actually really fatigued and we do need to do something quieter, maybe we're poorly, then we also need to notice what happens, because I sometimes work with people where when they do try and slow down, they start feeling guilty, or they start feeling worried about all the stuff they're not doing, and they become quite critical of themselves. So we need to weave it with self-compassion, with recognition of, well, actually today I'm not doing so well, and I'm really tired, I'm not feeling great, and what I really need is some downtime to recharge quietly, and giving myself permission to do that without that haranguing mind saying, no, you should be doing more. So I think it's adapting, like you say, on a daily basis. The other thing that I think can be helpful is to try and think about, because there is a risk that it feels like another set of things to shoehorn into a really busy day when I'm already stressed. I've got family life to juggle, I've got working patterns, I've got shifts or long days at work. I just don't have enough time to add in more. And that just feels like a duty on top. And it's just another thing to stress about. And so if that's the case, it might be about giving ourselves permission to let go of something and replace it with something that's more enjoyable. It might also be about some of the things that we do and making them more fun, so that we can weave in fun to what we do already. So maybe listening to an audiobook on the commute or whilst we're doing the washing, so that suddenly it becomes something quite enjoyable, and making sure it's an audiobook that we really like, that's something fun that actually lifts us, and not like doing some CPD, something that feels quite enjoyable.
I agree. I do think one of the things that we see, that I see quite a lot in my work with staff, is that people will get very busy in their lives. There'll be something going on at home, something going on at work, and their busyness will get off. It will increase. So there'll be a lot more energy draining from them. And the way that they'll manage that is by cutting out those things that re-energize them, that charge them back up again. So they'll stop seeing their friends, or they'll stop going to the gym because there isn't time, or stop their mindfulness. And that is a really big mistake, because I think there is something helpful about thinking about these things as a balance. So if you've got more things actually draining you, you do need to somehow create, and we never find time because we're all too busy to find time. We need to create time to do things to recharge us. And if we don't, unfortunately, it's like having a lot of distance to drive in your electric car and thinking, well, I'll manage that by not calling in at the charging station. It doesn't work. Or it's like if you've got lots of phone calls to make, thinking, well, that means I haven't got time to charge my phone. And of course, it doesn't work. It eventually all gets out of balance. So I do think looking after our well-being, looking after these activities to keep us well, does need to be intentional. It does need to be planned, and it's not always easy. But then that is the decision. If you want to thrive, I think you really do need to prioritize these, and you need to stop feeling guilty about them, because they are about leading your life in a way that's thriving.
Yeah, so it really comes back to values, and we talked a bit in our episode on boundaries, and it feels like this also echoes that, where it might be around making choices and remembering that every time we say yes to an extra task at work or yes to an extra project, we're saying no to time for ourselves or time to recharge. And actually, we need to be saying yes to time to ourselves, yes to self-care, yes to time to go to that charging station, and actually give ourselves enough time for it to make an actual difference, and not squeeze it in. And it might also require putting a bit of space before and after, so that it isn't just squeezed in and it just feels very stressful, where we're bouncing from one activity to the next without a pause. And so it might be that something does need to be reduced, and obviously only an individual can think about that, but it does sound like that's an important sort of part of it, doesn't it?
Yeah, that's right. I was just remembering about that, going from one thing to another, about one of the healthcare staff that I saw in my burnout group over the summer, and he said he was happy for he'd been happy for me to discuss this. He said he was like a ping pong ball. He said he was either on the work, kind of bang between work or bang between home life, and he never stopped, never had any time for himself, never had any time to recharge. And it just reminded me about that I think there's a lot of healthcare staff are kind of leading ping pong ball lives, either at work, busy at home, and where is the time for them, and for them to thrive and look after themselves.
Yeah, and I think if you think about the sort of three circles model of emotions, the threat system and the drive system, and then the soothing and self-care system, it feels like the two ping pong bats are going to be threat and drive, and they're going to be bouncing between threat, I'm not good enough, or I'm failing, drive, do more, do more, do more, and they will just bounce back and forth. And the third circle, which is the actually look after myself, take some time, build relationships, wind down, do things that are fun, doesn't get a look in, because it's frantically, exactly as you say, playing ping pong between those two systems. So I think that's a really important idea, that thriving means we need the triad, we need all three. It doesn't mean that we don't have some moments of stress and threat. It doesn't mean that we don't engage in things that are important and go to work and do our important tasks, but we also need that third, which is I'm going to do stuff that looks after me, and that's mandatory. That's not a nice to have. It's like it's part of what keeps the whole system operating. So could we move on to the hazards, the anticipate hazards? What kind of things do you think people should be looking out for?
Yeah, so yeah, and I think this is really important, and especially as a lot of these hazards are things that happen in our personal life. And one thing I've heard a lot of people say to me is, I lead my life as if I haven't got a personal. I lead my work life as if I haven't got a personal life. So whatever's going on at home, people try and behave exactly the same at work. And actually, sometimes things are going on in our life which need us to make adjustments. And so big things that happen to us in life are change. So periods of change in our life, disagreements, disagreements with loved ones or with other people, bereavements. We all experience bereavements, and it takes a lot of energy, a bereavement, as well as other things. And also, some of us will have periods in our lives where we feel quite lonely, and that takes a lot of energy too. So they're the kind of big adjustments. And if one of those is coming, because you can often anticipate change, you can sometimes anticipate bereavements, you might need to make change. You might need to adjust your life. You might need to think, okay, I'm going to focus more during this period of seeing my social network. I'm going to focus more about doing more of those things that I know are good for my energy, because I'm going to have to do that. I might need to take less on at work during that period. And it's about seeing the road ahead and making plans for it, and not just kind of carrying on as if these things aren't happening, I think.
Yeah, I really like that idea. And I think it's about being quite authentic, being ourselves and being the self we want to be, which doesn't mean we don't care about work or we don't prioritize work, but it doesn't mean that we ignore our needs or that we're so worried about how people will view us that we don't share anything, or we just over push ourselves because we're not willing to ask for help or support when we may really, really benefit from it. So exactly that, it feels so important to be a whole person, and nobody's just the shiny version of themselves. We're all a mixture, and we all need support at times, and I feel like if we're able to offer it and receive it, that strengthens our workplace immeasurably, doesn't it?
Yeah, agree 100%. Yeah, that interdependence. Yeah.
Do you think there's something about recognizing, so if people have particular triggers, so knowing, okay, there's a busy period coming up at work, or I'm going to have to interact with a manager who I find quite challenging, and we're going to be working on a project together, or I've had a change in manager and I'm now having regular meetings with somebody that I find a lot more difficult than I used to with the previous manager, for example. Um, do you think that's also important to acknowledge and prepare for those?
Yeah, absolutely. It's all of those are really, really significant, aren't they? And yeah, and I think it really helps preparing for them. And I'd argue this is also where your support network can come through. So, if you've got those difficult conversations coming up, you know, don't go into them without preparing. Talk them through with your support network. Talk them through with a wise colleague or friend. Even maybe role play it. Have a practice at the difficult conversations. So yes, really important to anticipate those difficult things and prepare for them.
Maybe that would be another good episode for us to talk about sometime. Richard is having those challenging conversations. Um, so let's move on to read our dashboard. And so that's about noticing the early warning signs. What do you think are the commonest early warning signs that people need to be aware of?
So common ones. So when I do workshops, I always, if I've got time, have a break where people write down what are their early signs of stress, because I think everyone should know their early signs of stress. Common ones are feeling irritable, withdrawing from people, so kind of staying in your office more or not meeting people for lunch, um, sleep going off, muscle ache, um, overworking can be an early warning sign of stress. So, but again, what's nice about early warning signs is they are quite individual. So you might know your own early warning sign. It might be quite individual for you. But once again, it's something for you to spot and look out for. So it may be something else. It might be over worrying or something like that, or um, I think I had somebody said they check the BBC website all the time at work because they kind of as a distraction. So keep an eye out for what your early warning sign is, or signs. And then if you see them, that is the sign that actually I'm starting to stop thriving. Stress is coming into my life, but my aim is to thrive. Therefore, let's do something about this. Let's not keep calm and carry on. Let's not ignore them. Let's actually, at the earliest opportunity, address this before it, by doing little things to balance things up, rather than having to kind of, ignore it and then have to do something quite big and risk stopping thriving for a period. So
Definitely. And one of the things I find, because when we're thinking about thriving, we're thinking about shifting from surviving upwards. And so people are not necessarily really unwell. They're kind of coping. They're all right, but we're not as doing as well as perhaps we could be if we put some energy into creating a really positive, thriving working environment. And so I think a lot of health and care professionals that I see, I find it quite easy to ignore early warning signs. And I think it is partly where we're trained into it culturally. We don't go to the loo when we need to. We don't stop for a drink. We work through lunch. We get quite caught up. It might be partly that we get quite hyper aware of things and we're very interested in what we're doing, and then so we forget to stop. So it's partly that we're busy, it's partly that maybe we don't read our internal signs very well, and it's partly that I think we're trained that we're not supposed to stop anyway. We should just keep going like a machine. So I think all of those things can make it quite difficult to read the dashboard, and I think we need to actually work out what kind of lights tend to show up on my dashboard. And some people don't notice emotions. It's like thirst means that you're already dehydrated. It's too late. And I think the same goes for when the light goes on, it might be a bit beyond. It might be that you've moved beyond. So we need to be thinking about, don't wait for the warning lights, even start noticing, start correcting. So maybe filling up the oil well before the light comes on, and don't just wait for it to tell you, because it may be that you don't notice then until it's actually really low. And so I think there's something about just trying to predict a dashboard and respond before the changes happen. And is that something that you would agree with?
Yeah, I mean that's absolutely ideal. I think what you've got is a health and care, social care workforce who are used to just keeping on swimming, so they just keep going regardless. So I think it's a step towards actually knowing what your dashboard is, picking up those signs. But actually, yes, you're right. If we really want to thrive, let's move beyond that. Let's move it so that those signs don't even come on our dashboard in the first place. That's your ideal thriving state, isn't it? And actually, when you've got those signs on your dashboard, they're a sign really that you're probably starting to move out of thriving. So if you're serious about thriving in your life, you need to be really paying attention to them.
Yeah, definitely. So I think it's about noticing, for me, what do I pick up? What is something that I can actually notice, that's really realistic, that I'm going to be able to recognize. And so for me, if my diary gets really busy, then I can start to feel, I get a bit of tension in my shoulders, and I might start losing a bit of patience. Not at work, like we say, we often retain that. I don't tend to show up at work and lose my patience, but at home. So I think it's about noticing these small changes where you're thinking, oh, feeling a bit full, and maybe I'm slightly less patient. Okay, what does that mean? And view it as data. It might be, well, it's just a busy period, it'll be fine. Or it might be, do I need to actually adjust something? So do you have any early warning signs that you can recognize, Richard?
Yeah, I'm quite lucky that my early warning sign is quite a hard sign, is the fact that my sleep goes off. So if my sleep goes off, I know, yeah, need to pay attention to something. And the one thing about your sleep going off is you can't really miss it. It's a very hard sign. So and that does go off, and then it makes me think, actually, what's going on? And yeah, often it's something like what's going on in the diary, or a challenging meeting coming up, or something like that. So yes, that's one of my key signs. and then maybe a little bit of empathy going off. So not being noticing that I'm not quite as engaged or as caring as I might be. So once again, that's a really important sign for me.
Yeah, and I think it's just accepting we're all allowed to have those moments, and we can be really compassionate about when this is happening, and explore it and view it as a sign that this is something I need to understand, and how can I look after myself? How can I support myself as that car to really maximize my well-being and then get back to doing the performance and living in a way that feels like it's thriving again. So I guess it's a bit like rupture and repair. We always have moments where we slip out, and it's how we respond to those, reading the dashboard. And then that comes on to early maintenance, which is
Mm.
then taking these righting actions when things are starting to slip, so that we might be slipping out of thriving back down towards surviving, hopefully not all the way down towards burnout, but sometimes that may happen. So what do you think that looks like?
Yeah, so the early maintenance, I think, is really important. It is that it's don't get sucked into keeping on swimming, don't get sucked in to keep calm and carry on, but nip it in the bud, do something about it. And that can be just us using our own toolkits, our own knowledge. We've got a lot of knowledge as health and social care professionals. Ask yourself. I use the idea of the things that are draining energy and the things that are radiating energy, charging energy. Has that got out of balance? Just have a think, and if it has, then kind of balance it up yourself. A bit like you were saying, Lee, looking at your diary, as the diary got a bit too packed, and do you need to spread things out a bit in the following weeks coming? So that looking at yourself, then reaching out to your kind of support crew. If my car isn't working, then I usually go to my father-in-law and say, or he's making a funny noise. What's going on here? And he usually know. So, but I'm not saying it has to be your father-in-law, but reach out to somebody around and say, actually, I've uh, actually I'm not thriving as much as I'd like to be. What's going on? Reach out for support there, and then ultimately you've got reaching out for professional support, and 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 NHS Practitioner Health is a massive source of professional support for health and social care professionals, and anyone can self-refer if they can't get a local confidential service. So NHS Practitioner Health is there, but it may be mentors or coaches or chaplain at work or something like that. Just work, reaching out to somebody who's kind of outside your normal support network. But the important thing is to do it and not to delay. Not to not to wait until you've stopped thriving or got into surviving or even got towards burnout. To do it early. Yeah.
Absolutely agree, because the earlier we do it, the more likely we are to get back to thriving rather than slipping in, getting stuck in surviving, or worse, getting stuck for quite a period of time in burnout, which is a really challenging life experience. And there are ways through it. There's lots of hope. But if we're able to recognize it much earlier, it feels like the swing is much less extreme, and it keeps life a lot more balanced, and that quality of life, we just maintain that. So it feels like that is really genuinely important thing to do, which is these very small writing actions. And again, there's probably less effort required at the thriving end of the spectrum than maybe once we become quite unwell and things have dipped a lot further. So actually, in terms of bang for our buck, I think a few small changes when we just need to thrive can make a massive difference to maintain it. So I think that's also really key.
Mhm.
So just to finish, we always try and end with a couple of practical tools or tips from today's conversation. So what are yours today, Richard?
I, I'm going to um, I'm going to bring in. I've been reading a book by Joshua Hartzell, who's he's an army doctor and also a leadership expert from the US, and he's written a recent book called A Prescription for Caring in Healthcare Leadership. And there are things we can do as individuals to thrive, but what Hartzell talks about is things we can do as organizations to thrive. And he has this really nice way of putting it. He says, if as leaders we can make the people we lead feel cared for, then they will care for the people that they work with. And he says, and then we've got an organization where everyone is caring for everyone else. And that is an organization where the people are thriving. And I really love that, because that's almost like you're beginning that garden, isn't it? With all the different flowers in, that's doing well, that is well watered with good soil. And I think that Hartzell idea of caring for people and then other people will then start caring for other people is such a powerful idea. So that's probably would be my closing point for this one. What about you, Lee?
Well, I think I'm going to go with the garden as well, because I just love it for imagery and as an idea. And I think it's about really thinking about what kind of garden would we love to have. Would it be a rolling garden with lots of wildflowers? Would it be contemporary with some statues? And we're all different, and we get, people's taste, people's interest will be so diverse, and that's what makes life so amazing and why our colleagues are so interesting. And so it's about working out for us, what kind of garden would I love to go out and spend time in. And then we need to put the nuts and bolts in, which we need to put the structure in place. We need to get the soil, get good quality soil. We might need to get plants. We might need to invest in some infrastructure, put in some paving stones. And there's so much, but actually that time and effort, and we may well need to spend time out there when it's raining, just taking out a few weeds. And sometimes it's not that joyful, but it's still doing it for a purpose, which is again purposeful activity. There's a sense of meaning around it, so we will engage in that. And we can maybe be quite peaceful. Maybe it's a place that we find that we're engaged, and so it's soothing to be out there. I think gardening is a very soothing kind of activity. So it feels like it's a really good analogy for what thriving looks like. But it might also be somewhere where you can go out and have fun, play football, have a kick around. So really it's about recognizing what would make it an amazing place for you, and then putting that stuff in place and then maintaining it. So keeping on doing that weeding over time, keeping on making sure, maybe we need some new garden chairs this year because they look a bit worn. So yeah, or new barbecue. So I think it's really trying to broaden that out and make it a lovely place to be. And that's what work, if work was like that, wouldn't that be amazing?
That'd be wonderful.
So thanks for joining us. We hope you found today's episode useful. In our next episode, we're going to be exploring how to cope with a busy mind, with worries or intrusive thoughts. And we really look forward to having you with us next time.